for our babies, Jazzy and Tia, it was, they had a little sore throat the first couple of days, but other than that, they bounced back and it's been life as normal. Happy babies running around and playing, but we have isolated ourselves as a family. It's what we had to do.
Wow, shocking. For more on this, hearty World Health Correspondent Nicola Hill joins us live from London. Nicola, incredible to hear what The Rock just said there. They got it from close friends that they love and trust. So what things are we learning about the most common ways to catch COVID-19?
Well, it seems getting it from close friends and family at the moment is the most common way that most of us who are becoming infected are actually getting the virus. I was speaking to Professor Linda Bold, who's a Professor of Public Health at Edinburgh University this morning. And she says because the way we've changed our lifestyle, people aren't going into the offices, we're staying at home much more. But now we're beginning to socialise. We're socialising with friends, we're socialising with family, and perhaps we're more relaxed. So we're not taking quite the same precautions with close friends and family as we might be if we're in the hospitality sector, for example. Sharing glasses, sharing cutlery, becoming close to each other, not wearing masks. And it's quite interesting that certainly here in the UK, where we've got local lockdowns, people are allowed to see friends in pubs, in restaurants, etc., but not in their own homes. And the government said it's because the hospitality sector's better set up for taking on board all the coronavirus recommendations, whereas perhaps at home we're a bit more relaxed.
And Nicola, Dwayne The Rock Johnson also spoke about masks. Let's take a listen now to what he had to say.
The other thing is wear your mask. We have been in quarantine for months. We wear our mask every day. It baffles me that some people out there, including some politicians, will take this idea of wearing masks and make it a political agenda, part of a political agenda, politicizing it. It has nothing to do with politics. Wear your mask. It is a fact, and it is the right thing to do, and it's the responsible thing to do, not only for yourself, but for your family and your loved ones, but also for your fellow human beings.
Strong words there. Nicola, I was in London recently, where you are, and I was very shocked at, I don't want to say few people, but not as many people as I imagined were wearing masks. And yet, the current figures in the UK are a very low infection rate. So what is the latest on masks?
Yeah, I think that's really worrying, isn't it? Public transport, people not wearing them, or worse, you see them not covering their noses, as though they seem to think that they only have to cover their mouths. It's quite interesting. There's been some research that's published in a journal called The Physics of Fluids. It's from Florida Atlantic University. That's actually showing the differences with different masks and visors. Now, certainly in my local hairdressers, my local restaurants, the staff there aren't wearing masks but are wearing visors, thinking that's just as effective. But this research shows that's not the case. The visor, it's this plastic visor you can wear in front of you. It might stop what you exhale going forward, but of course it can come underneath. Then it can spread, and the research has shown that these aerosol droplets can actually spread for quite a long way. And the same scientists also did a study looking at masks. They looked at these N95 masks, something that we'd never heard about last year, but the ones that have got the valves in. And they showed that the valves may well filter what people breathe in. That's if they're fitted properly, and unfortunately that's often not the case. But because they've got these ventilated pieces in them, they've got holes in them. And so what comes out does mean that droplets, when they exhale, these droplets, these tiny aerosol droplets can come out. So they might be thinking that they're protecting themselves, but they're not really protecting other people in the same way. Also, a lot of these so-called N95 masks apparently are knockoff copies, and they're not as effective. So what we're being told really is the best option is the old-fashioned one. So it's this type of surgical mask, the 3-ply one, that has that metal bit at the top so you can fit it closely around your nose. or a cloth one that's again made of 3 pieces of fabric. So these are actually the best ones that we should be using, and we should wear them all the time when we're outside, and we should cover our nose as well as our mouth.
Absolutely. Nicola, thanks so much for reinforcing that message. Thank you so much. Nicola Hill, live for us there in London.